Good day, I am Laidelle Jascinth. Today, I will be discussing about mumps, its pathogenesis, clinical manifestations, diagnostic and laboratory procedures, its treatment modalities, medical management, nursing diagnosis and management, as well as its prognosis. So buckle up your seat because I'm about to begin my discussion. Mumps, epidemic parotitis. Description of the disease. Mumps is a viral infection that primarily affects saliva-producing glands that are located near your ears. Mumps can cause swelling in one or both of these glands. Pathogenesis. Mumps is caused by the mumps virus, which belongs to a family of viruses known as paramyxoviruses. These viruses are a common source of infection, particularly in children. When you get mumps, the virus moves from your respiratory tract, your nose, mouth, and throat into your parotid glands, or the saliva-producing glands found either side of your face, where it begins to reproduce. This causes the glands to swell. The virus can also enter your cerebrospinal fluid or CSF, which is the fluid that surrounds and protects your brain and spine. Once the virus has entered the CSF, it can spread to other parts of your body such as your brain, pancreas, testicles in boys and men, and ovaries in girls and women. Clinical manifestations. The most obvious symptom is swelling of the salivary glands, giving the patient a hamster-like face. Symptoms of mumps usually appear within the 2 weeks of exposure to the virus. Flu-like symptoms may be the first to appear, including fatigue, body aches, and headache, as well as loss of appetite and low-grade fever. A high fever of 100 degrees Fahrenheit or 39 degrees Celsius and swelling of the salivary glands follow over the next few days. The glands may not all swell at once. More commonly, they swell and become painful periodically. You are most likely to pass the mumps virus to another person from the time you come into contact with the virus to when your parotid glands swell. Diagnostics and Laboratory Procedure. Serological tests, IgM antibody detection. Mumps is confirmed by detecting mumps IgM antibody in serum samples collected as soon as possible after the symptom onset. Virus culture from throat or cheek swab. The swab collects mucus and cells and is sent to a lab to be tested for the mumps virus. Urinalysis. With the mumps virus detected in urine within the first 2 weeks of illness. Treatment modalities. There is no treatment for mumps. The disease must be allowed to run in its course. Drink plenty of fluids, but avoid acidic drinks such as fruit juice, as this can irritate your parotid glands. Water is usually the best fluid to drink to relieve symptoms of mumps. Get sufficient rest and sleep. Eat mushy or liquid food, as chewing might be painful. Gargle warm salt water. Place something cold on the swollen area in order to alleviate the pain. Medical management. Non-aspirin medications such as acetaminophen and ibuprofen can be used to bring a fever under control and help with pain from swollen glands. Nursing, diagnosis, and management. Nursing diagnosis. Hyperthermia related to viral infection as evidenced by temperature of 38.5 degrees Celsius. Nursing management. Assess the patient's vital signs at least every hour. Increase the intervals between vital signs taking as the patient's vital signs become stable in order to assess in creating an accurate diagnosis and monitor effectiveness of medical treatment. Administer the prescribed antipyretic and pain reliever medications. Remove excessive clothing, blankets, and linens. Adjust the room temperature in order to regulate the temperature of the environment and to make it more comfortable for the patient. Offer a tepid sponge bath in order to facilitate the body in cooling down and to provide comfort. Elevate the head of the bed in order to promote lung expansion. Nursing diagnosis. Fatigue related to stressors as evidenced by overwhelming lack of energy, verbalization of tiredness, and generalized weakness. Nursing management. Assess the patient's degree of fatigability by asking to rate his or her fatigue level. Explore activities of daily living as well as actual and perceived limitations to physical activity in order to create baseline of activity levels, degree of fatigability, and mental status related to fatigue and activity intolerance. Encourage progressive activity through self-care and exercise as tolerated in order to gradually increase the patient's tolerance to physical activity. Teach deep breathing exercises and relaxation techniques in order to allow patient to relax while at rest and to allow enough oxygenation in the room. Nursing diagnosis. Acute pain related to impaired skin integrity or edema. Nursing management. Perform a comprehensive assessment of pain. Determine via assessment the location, characteristics, onset, duration, frequency, quality, and severity of pain. Determine the client's perception and location of pain, as well as provide pharmacologic pain management as ordered. Provide non-pharmacologic pain management. It includes physical, cognitive behavioral strategies, and lifestyle pain management. These methods are used to provide comfort by altering psychological responses to pain. Prognosis. The prognosis of mumps infection is usually good. Children with mumps typically fully recover within a few weeks. When mumps occurs among adults, the illness is more likely to be severe. References.
Thank you so much for watching. I hope you have learned a lot from this video. Click like, share, and subscribe to this channel for more educational videos related to medical surgical nursing.
Thanks for watching. Drop a like, leave a comment, and don't forget to subscribe.